And if you know that you have gone through certain surgeries or some sort of chemotherapy before, or had some pelvic infections before, then you should visit. You should not wait for that.
Okay, there is something called the Klinefelter syndrome. Can you maybe talk to us about that?
That's a genetic symptoms, the Klinefelter, where the sperms, the male infertility is one of the cause of the male infertility. Yeah.
And maybe are there some of the things maybe men can look out for to maybe try and know that maybe there is a problem, maybe in terms of looking at the testicle? Maybe is it the testicle size? Is it maybe, are there some of the signs a man can look out for to just determine whether there is a problem here before maybe that 1 year lapses?
Yeah, so if one has some sort of infection in childhood, like mumps or some testicular trauma, if there is like you can see the size of the testis, right? If it is quite small or peanut size, or sometimes there is undescending testis, right? So those men should come a bit early. And if someone is going for like chemotherapy, testicular chemotherapy, so those men should come early to the clinic and ask for the help.
And maybe in terms of, I know most people, I'm looking at Twitter, most people are asking this, in terms of charges, is it an expensive affair to just come and do these tests? Maybe you can shed more light on that for those who are scared of the costs.
The cost for both male and female?
Yes.
Yeah, for testing male is not that expensive, around at 3,000 to 5,000. You can have semen analysis. And for female it is because they have to go through a wide variety of tests. Because for male it is easy. It is just their semen analysis and then they can prove their fertility. They can know their fertility status. But the God has given female so many reproductive organs. It's 5 reproductive organs. The ovary, fallopian tube, uterus, cervix, and vagina. And so we have to test all these things. So the test will be somewhere around, say, 20,000. To test the ovarian reserve, to test the fallopian tube, whether it is open or not, to have an ultrasound and some hormone test.
That's for the female now, 20. For the men, it's between 3,000 to 5,000.
For female, it's mostly what they need to know, that whether their fallopian tube are open or not, whether what is the ovarian status, how many eggs are there left with, how is the uterus, whether there is any fibroids or not that can affect their fertility.
Okay.
Okay, you can say welcome back. Thank you.
She had stepped out.
Yes, I had. And I'm seeing a lot of conversations on Twitter, and people are saying this is a very difficult topic to have. Because normally, again, it's not something that you talk about.
We are Africans.
Yeah, we're Africans, we're Kenyans. How dare you say that the problem is the man? We are not wired to believe that the problem can ever be the man. Not in this life, not in Africa. I can see Jokiashi saying, Cynthia, we will only say these things. We are Africans and Africans in our business. So we are going to keep quiet while you two talk. And then after you're done, we will quietly ask contacts of Dr. Rajesh, but also where his clinic is, so that we can talk to him. Dr. Rajesh, where is your clinic and how can people reach you?
So my clinic is there at Upper Hill, Hospital Road, and there is a 40-suite building there, and it is in the ground floor.
Ground floor. What's the name?
Clinic name is Fertility Point.
Fertility Point. Yeah. So take note. Akina Jeremiah Karaoke, Ngongu Kerie, ninasema loudly because we'll be needing your chairman, so that the chairman can let the other people know. Mzai and chairman, let people know where Fertility Point is located, so that you can tell your other African friends. Okay. Thank you. So finally, Leon has joined us. Thank you very much, President Kingston. We appreciate it. We are at your mercy because ours is to wait for you.
Come at 8.
Right? The audacity of this man.
Apparently, at fact, where the chairman of RMS parks. So
that's no problem. As a journalist, if you're told to come in at 8, you come in